Hi everyone, it's Alexa, and this is my Nursing 335 clinical reflection presentation. I just wanted to say that I'm attaching this PowerPoint in the Canvas Dropbox as well because I know my recording is covering some of the text on my slides. So moving into the objectives, the first objective for this course is to apply knowledge from previous courses in the physical and social sciences, humanities, and nursing in meeting the multidimensional needs of individuals and groups within the local geographic area. So this is all of the knowledge we've had from the prerequisites to the nursing program, and I think this also applies to knowledge in general, like things we've learned throughout our life and school that we've taken with us to be nurses. Two is to apply the basic principles of ethics, management, and leadership to meet the needs of patients and their families. Like leadership in terms of nursing could be stepping up when another team member needs it, on the floor, on the unit, like pulling each other's weight and working as a team. And then this also applies to the ANA Code of Ethics, which I'm going to discuss on the next few slides. The third one is evaluate the effectiveness of communication in promoting the optimal health of patients and their families. So this is something nurses always do, and of course nursing students would do as well. Number four is critically analyze and integrate leadership research findings into the total plan of care for a selected group of patients and their families. So this is super important, and this is specific to the articles that I found for this class, which I'll be discussing later. The fifth objective is apply the principles of ethics, advocacy, and teaching to do the everyday care of patients and their families. So this is done all the time, advocacy, teaching, and abiding by the ANA Code of Ethics also applies to this objective. Six, formulate plans for continued personal leadership growth and development as an independent practitioner of nursing. So this is an ongoing and continuous job because you always want to be better as a nurse for yourself and your patients. Seven is recognize the role of the nurse in policy making related to healthcare services at local, state, national, and global levels. So this is more specific to my political hours, which I'll be discussing. And then eight, predict and describe potential ethical dilemmas within clinical and organizational and professional nursing practice. So this also relates to the ANA Code of Ethics, and this is something that obviously nurses and honestly everyone is just aware of at all times because ethical dilemmas are everywhere. So the ANA Code of Ethics was a huge part of this class because ethics govern how a nurse works basically, and in specific the nurses focus on the ANA, the American Nurse Association's Code of Ethics, which is used to govern nurses across the United States and helps reiterate ethical duties in their profession. So there is 9 provisions, 1 through 9, which I'm going to summarize for you, and this is just rules that nurses abide by at all times. So this is relative to the objective 2, 5, and 8 that I discussed earlier. So the first provision of the Code of Ethics, just as a reminder, is practicing with compassion and respect for all patients. 2, commitment to the patient and the family as the nurse. 3, advocate for the rights and protect the patient's rights. So advocating for them and protecting their rights. 4, making decisions and taking action to give the best care possible for your patient. 5, owing the same rights to yourself as a patient, so not only worrying about your patients, but as the nurse, you need to take care of yourself so you are able to care for your patients to the best of your ability. 6, maintaining and improving an ethical and safe environment. And 7, advancing profession and research, which is specific to objective number 4 for this course. 8, collaborating with other members of the healthcare teams to increase patient outcomes. And 9, articulating values and maintaining integrity and social justice in nursing. So the first category that we were to complete was advanced practice. So this category overall helped fulfill objectives 1, 2, 3, and 7 of this course, which relates to previous knowledge, communication, ethics, advocacy, teaching, and policy making. So all of these things listed I participated in throughout the semester, and they were all meetings on Zoom because of the pandemic, but then there was a following discussion board to debrief and summarize the learning and understanding. So I did a nurse anesthetist session, nurse practitioner program session, nursing educator, mental health nurse practitioner, nurse researcher, case manager, and advanced practice with Dr. Martonic. For nursing supervisor, this was kind of a different way that we had to complete this category this semester due to the pandemic. We were supposed to shadow a nurse supervisor to focus on triage and staffing in the hospital, but because we weren't able to do this, we were allowed to supplement this category with any other thing that we feel fit. So I did mine, I completed my hours through peer leadership, which was through labor and delivery, which I'll discuss in a few slides when I get to peer leadership. But this nursing supervisor met objectives 1, 2, 3, 5, 6, and 8. So that would be taking previous knowledge into the nursing supervisor role, the principles of ethics, communication, ethics, advocacy, teaching, plans for personal development as a nurse, and ethical dilemmas in practice. So for political and legislative leadership, I completed a variety of things. I kind of mixed it up. So I did a John Lewis movie at the beginning of the semester, the presidential debate, one of those, one of the vice presidential debates, and then I voted in the presidential election. There was a lot of opportunities this year because of the election year. The objectives that this category met was 1, 2, 3, 5, and 7. So that's going to be bringing in knowledge from previous classes, principles of ethics to meet patient needs, communication, ethics and advocacy, and teaching again, as well as the role of the nurse in policy change, which was pretty specific to this category. So community leadership, this is where I chose to do donations because I feel like it's the easiest way that you could help the community out without having to spend a bunch of money because like we are college kids. So I donated blood to the Miller Keystone Blood Center for the first time. I normally don't like giving blood, but I thought this was a really good reason to, get myself to do it because it helps others. So that was nice. And I did it with my family, so we all went together. And then I donated clothes and home items to Goodwill, just kind of like clothes that don't fit anymore, some like home stuff, kitchen stuff that my mom didn't need, and stuff like that. So this category completed objectives 1, 2, 3, 5, 6, and 7. So again, that is incorporating previous knowledge from other classes, relating to ethics to meet the patient's needs, communication, ethics, advocacy, and teaching, making plans for personal development as a nurse, like kind of being aware that there are people who have different needs in a variety of ways and being able to recognize that so that you can address it in the clinical setting. Making plans for personal growth, well, that's what I said, sorry. And then number 7, which is policy making in healthcare. So service leadership, this was one of my favorite categories. So I went to the neighborhood center, which is in the Salvation Army, and it is an after-school program. It was really fun and rewarding because a lot of the kids were younger and they don't have young adult leaders there. All of the like quote unquote teachers or caregivers there are all middle-aged or older. So I think they were really happy to see like younger kids that wanted to interact with them. So that was really nice and it was really fun. Honestly, I want to go back and do more hours when I have the time, like not just for class, but just to help them out. So I did 12 hours over the course of 5 days, and this completed objectives 1, 2, 3, 5, 6, and 7, just like the last one. So that is incorporating previous knowledge from other classes, the principles of ethics to meet patient needs, communication, ethics, advocacy, and teaching, making plans for personal growth, as well as policy making in the healthcare field. So the interprofessional portion of leadership, these were videos that were posted from different members of the healthcare team. So there was occupational therapy, education, and social work. So there was videos posted all about their professions and how they work with nurses, which was cool because we don't always get to see this kind of like the collaboration like in clinical. So I've seen a lot of PT and OT, but like not education, not social work. So that was nice. And then there was a discussion board to summarize our findings of what we learned. So this category met objectives 1, 2, 3, 5, 6, and 8. So that is going to be previous knowledge from other classes, principles of ethics related to the code, communication, ethics advocacy, and teaching, making plans for personal development, and ethical dilemmas in practice. So continuing education, this was a diverse kind of group of activities that I completed, but overall was all really relevant to what is going on and very educational. So I did Bias and Barriers Prevented by Cedar Crest's own Center for Diversity and Inclusion. There was an outside speaker. He was really cool and just kind of discussed his challenges with being queer. I did the Lehigh Valley Health Network's Run Through Eating Disorders presentation, which was really interesting because it went into um, not only like what is an eating disorder, but kind of how to maneuver a patient, like how to care for a patient who has an eating disorder, which I have not had the opportunity to experience. I have not had a patient like that. So it was a nice refresher to like remind you like how you should treat them and reminder to like watch what you're saying in terms of like food and eating and that kind of stuff. I did the Student Nurses Association's Dine and Discuss. So this was with Mackenzie Miller last week, and she's an alumni, a former student. She graduated 3 years ago, and she was discussing her time in labor and delivery and travel nursing. And I'm really interested in labor and delivery, so that was really cool to hear somebody like my own age who went through the program, like finding their fit and everything. And then I did a residency webinar which was detecting the right fit, and that was related to nurse residency programs. So once you graduate, like finding an institution that has a residency program so that you can best serve as like have the best resources to begin your career as a nurse. And this category completed objectives 1, 2, 3, and 6 of the course. So previous learned knowledge, principles of ethics, communication, as well as making plans for personal growth and development. Peer leadership. So all of these were completed at the Lehigh Valley Cedar Crest location, and it's just going back into like classes you've already had with the younger nursing students to like answer any of their questions, help them out, help the teachers. So I did a mental health simulation day at school with the kids in 313, and then I did labor and delivery for nursing 320 as well as the mom baby unit postpartum. So this category was one of my favorites just because I was able to like go back into those classes and I didn't have to worry about like filling out packets or doing any of that like I did when I was in the class, but it was more just like talking to the kids and being able to like recall the knowledge I had and use it, which was really cool. This category met objectives 1, 2, 3, 5, 6, and 8. So this is going to be recalling knowledge from previous classes, the principles of ethics related to the code to meet patients' needs, communication, ethics advocacy and teaching, as well as ethical dilemmas in practice. So independent was a catch-all category. I did donations to the Salvation Army, food of course, the food bank, donations to the Humane Society, so like treats, pet toys, blankets. I did an educational poster on preventing infection because I think that's very relevant right now with COVID-19. And then I did knock down the house political film about AOC. So this category met objectives 1, 2, 3, and 6, which is bringing in culminative knowledge from previous courses, principles of ethics, communication, as well as making plans for personal and professional growth. Patient logistics, this was a really cool experience. It was cool to see what happens behind the scenes. This is how they manage like who goes to what bed in the hospital. So we did 2 hours of observation and it was really fun. And this met objectives 1, 2, 3, and 3. So previous knowledge, principles of ethics, as well as communication. Post-conference, we are having a 3-hour meeting with our faculty member as well as our classmates to debrief this semester and our experiences, which discusses the articles we found, which I'll talk about on the next slide. And this met objectives 1, 2, 3, and 4, previous knowledge, principles of ethics, communication, as well as leadership research. So the articles that I have were related to bullying, and research was related to leadership style affecting care. And I'm not going to go into the specifics of the articles because we're going to discuss that in post-conference, but those met objectives as well as the prep work. So with the articles that met objectives 1, 2, 3, 5, 6, 7, 8, and the prep work 1, 2, 3, 4, and 6. So just in conclusion, I had 87.25 hours. I loved this clinical. I think it was a nice, fun way to complete the requirements, and I had a great semester. So thanks for watching. Here's my references.